And then, of course, if you do happen to come across a patient who's been awake during a previous operation, these patients are often extremely anxious or worried about their anaesthetic. And if the anaesthetic doesn't involve muscle relaxants that you're about to go, well, that's fine. You can reassure them very quickly about the issues of muscle relaxants and awareness. But if it's a more major thing where they will need muscle relaxants to be given, you can explain the isolated forearm technique with them. And I must have done that probably into double figures now. And the patients really understand it very quickly. They seem to understand it much quicker than many anaesthetists understand it when I try to explain the technique to them. And and that actually relieves them. They, rather than being worried, they are very relieved. And it's interesting that when I've been lecturing, many of the delegates will come in and say, well, how do you get patients to go in your trial when you tell them they're going to be awake during their operation? I said, no, you have the wrong end of the stick. They're not intended to be awake during the operation. I tell them there's a possibility they will be awake, that I am doing this anaesthetic using a particular monitoring technique which is supposed to tell me if you are conscious or unconscious, but this is my backup, and if you happen to wake up, you can tell me you're awake. And they are very glad, they're more than happy to come into the research project knowing they're going to have this drug that will paralyze them, but they actually do still have a means of communicating with me.